acknowledge all the people that have given and continue to give every day, and all the lives that have been lost in this pandemic. And that's something we want to really carry as a theme, because that loss is tied to a lot of heartbreak, family members and friends, and challenges. And so we want to reflect on that today as we go through our briefing. As we start today, I'd like to hand over the podium to our county executive, who has been a stalwart supporter of us throughout this process and this pandemic response, and we again appreciate his leadership. Armin Budish.
Good morning. Every week I start by thanking Terry Allen and Dr. Gullett and the entire staff that works here at the Board of Health. They are really saving people's lives. It's remarkable, all the work that they're doing with a relatively small staff and throughout the county, helping people that need the help, and so we really appreciate it. It means a lot. The coronavirus is a terrible disease. It's a killer. So far, 42 of our family members and friends and neighbors here in Cuyahoga County have died. And thousands more have passed away around the country. So this week, to remember those who we've lost, I ordered that the flags on our county buildings fly at half staff. And we'll continue that as long as this crisis continues. And I invite others around our community to do the same thing. It's important that we all keep in mind the good people we've lost. Today I'd like to give you an update about our Small Business Resource Center. I want to announce that our Small Business Stabilization Fund is now open for business. As you know, the governor issued a stay-at-home order to slow down the spread of the coronavirus, and this seems to be working. Unfortunately, stores and businesses, especially small businesses, are suffering terribly. Just drive down or walk down the streets in your neighborhood and you can see what I'm talking about. You all know it very well. Many stores are shuttered. It's eerie to walk around to see the lights out in so many businesses. Almost everything is shut down. Small businesses are the lifeblood of our community. They're the lifeblood of our economy. We must do all that we can to help them survive. These next days and weeks are crucial to their surviving this crisis. We want to make sure that when business are allowed to reopen, that they can reopen and that they can bring back the employees that they have had to lay off. Those employees are suffering greatly. So we're taking action. First, we've created a Small Business Resource Center. Businesses can call our number, 216-452-9714. That's the number for the Resource Center, 216-452-9714, for instructions and help to get available resources. The website is cuyahogacounty.us/helpforbusiness. The Resource Center over the last couple weeks has received calls from about 400 small businesses. The center is staffed by our small business partners. When a small business owner calls the Resource Center, they'll get information about 2 programs under the Small Business Administration. First is the Economic Injury Disaster Loan Program, or EDL. Under this program, businesses can get a low-interest loan for up to $2 million, and at the same time, people can apply for an emergency $10,000 loan. That loan does not have to be paid back even if the business does not qualify and does not get the EDL loan, the larger loan. For this program, you can call the Small Business Administration directly at 800-659-2955, or you can call our Resource Center. If you call the Resource Center, we can help you with the entire loan process. The second SBA loan program is the Paycheck Protection Act. This is a forgivable loan of up to $10 million. For this loan, business owners are advised to contact the bank that they have a relationship with. Even a checking account is considered a relationship. Again, our Resource Center can help. The problem is that not everyone will qualify for these federal programs. Even if you do qualify, you may have to wait weeks or months for the loan cash to come through. And yesterday, the Paycheck Protection Act ran out of money. Congress is working to try to add money to the Paycheck Protection Program, but has not yet done so, and right now it is closed. So to fill the gaps in the federal programs, we've created the Small Business Stabilization Fund. To date, we've raised over $4 million for the fund, and we're continuing to fundraise. The fund will make grants to businesses with up to 20 employees, and it'll make loans for businesses up to 500 employees. Grants can be up to $5,000, loans up to $50,000. This is a community collaboration. I want to thank those who have joined us at Cuyahoga County to support the Resource Center and the Stabilization Fund. The Economic Community Development Institute, ECDI, which will coordinate the fund. Jumpstart, in partnership with the Key Bank Foundation. Village Capital, the Greater Cleveland Partnership Business Growth Collaborative, and the Urban League. In addition, I'd like to recognize the contributions of our other partners in standing up the Cuyahoga County Small Business Resource Center. These additional partners include Cleveland Neighborhood Progress, the Greater Cleveland Partnership and COSY, Growth Opportunity Partners, HFLA of Northeast Ohio, the Hispanic Business Center, Magnet, and Ohio Means Jobs. And then I also want to thank especially our County Skill Up team. I'm joined here today by Danielle Sidnor. Is Danielle in the room? There in the back. Danielle has done an amazing job of helping us staff up the Stabilization Fund. I want to thank Danielle and every one of our partners. This was a complex collaboration. Danielle's shaking her head yes. It was a complex collaboration over a pretty short period of time. So it's pretty remarkable what they were able to do. Businesses can begin applying for the grants or loans today by filling out a business assistance application on our website. Again, that's cuyahogacounty.us/helpforbusiness. Our goal is to start getting the money into the hands of small businesses during the week of April 27th. While the money we raised is great, it's nowhere near enough to support all the small businesses that need our help. We'll continue to try to enhance the program as we move forward. When this crisis ends, and it will end, we'll come out of this with new tools and new resources, which will make us stronger than ever. I certainly look forward to that day. Thank you.
Thank you, Armin. And the Board of Health will certainly, in honor and recognition of those that have died, will, of course, participate and lower our flags for the duration. I think it's an important gesture to remember what's happened and what the losses are relative to this pandemic. So You saw us enter today, and I know many here in the media now have their masks with them. I think what we are trying to make clear is that we are amidst a new normal here going forward as we adapt to the situation and the impact and the ongoing reality that we're going to be living with COVID-19 for some time to come in our community and in the country. And so that will mean, as we go forward, that there will need to be some changes in how we adapt. So there's been a lot of change that we've all adapted to in how we interact socially, relative to how children are being educated, how we receive our resources, how we work. All these things have evolved, and we continue to adapt to those changes, and we recognize that, and I think we're all very proud to be part of the Ohio plan. And we've done our part here locally to support the Ohio plan at reducing fatalities, at reducing cases, and will continue to do so. So for me, our thoughts are with the workers who have been getting up every morning to meet these challenges. They're doctors, nurses, and healthcare workers. They're road maintenance crew workers, and construction workers, and retail employees, mail carriers, truck drivers, and other delivery personnel. They're the folks working at the restaurants, and people like safety forces and, yes, local health department employees who are responding every day to the uncertainty that is currently before us and what may come to pass. The performance of their jobs is vital in everyday life to keep our society with some sense of normalcy to meet basic needs. Along with those agencies are a range of social service points of contact here, like the food bank and other agencies that have stepped up to meet needs that have emerged from populations that are under-resourced in our county. And we think it's important to recognize that that the COVID-19 pandemic has also illuminated the disparities that exist in our society and the injustices in our society as it relates to people of color. And Dr. Gullett will provide some data going forward to make sure that people keep that at the center of what we're discussing. So we would want you to acknowledge these public servants and the work that they do from the start, and we'll stay with them and keep them in our hearts and minds going forward. So we heard recently, all of us, that Governor DeWine has noted he's going to begin to address a return to activity in our state beginning on May 1st. And so we need to know, and we're all asking ourselves, is exactly what will that mean? And I think as we know those details are forthcoming, we know it will be a phased-in approach. This is part of a national dialogue about how we, as Americans, Ohioans, and Greater Clevelanders, will adapt to this new normal and begin to stand back up the components of our society that are vital to our economy, to our citizens, and do that in a way that is safe and protective. And so this idea of doing it in a phased and iterative and gradual approach that the state is prescribing is essential. And so we stand ready to work with the governor and Dr. Acton and our community members here in responding. The new normal will include recommendations and guidance around masks. This particular mask was made by my daughter Fiona's, her boyfriend's mom, Lisa Anguilano. So Lisa, thank you for the mask. She's part of a group. If you're up, Lisa, and you're busy making masks, which you probably are, they're making masks for hospital workers. And so she was nice enough to provide me one, and I had to have a corollary to Dr. Gullett's Brown's mask. And so I'm happy to have this. So that may mean that masks is one part of that. It will include social distancing and the physical distancing that we've all come to understand and see more and more people comply with. Just because the weather gets warm doesn't mean that we need to do away with this new normal. It means as we stand back up components of society that we need to double down on these changes. And I think that's an important point. As it relates to remote work, gatherings of people, and a range of these controls that we put in place until and only when we have a vaccine available or in a position to distribute the vaccine in our communities and around the country. For me, this harkens back to the H1N1 pandemic in 2009 and 2010, when health departments across the country, working with their communities, stood up points of dispensing or pods to distribute vaccine to community members based on plans that are put in place working with our state health department and the CDC. And so until that time, we need to be vigilant. And so testing must be expanded and continue to be expanded in communities so that we can understand the scope and magnitude of those exposed in the community. And so that is critical, that even as we stand points of society back up, that testing is expanded. And we expect that to continue to ramp up as it has been around the country going forward, and we expect that to continue here. In the meantime, local health departments and the Cuyahoga County Health Department will continue to be on the front lines of the pandemic response along with our community partners. You all know that in accordance with the recent state order, the Ohio Department of Health has released a list of long-term care facilities that have experienced cases of COVID-19, and they're posting that information on their website. It's important to remember that the presence of COVID-19 in these facilities is not a surprise for public health. We know congregate settings like correctional facilities and long-term care facilities and the like are places where people are in close contact. And so consequently, particularly with long-term care facilities, we know that there are a lot of at-risk people that live in those facilities. And we need to recognize that. And the workers that are coming in every day and continue to come in every day to respond and staff those facilities to work to control the spread and to care for those that are living not only with a number of conditions that they may be dealing with from chronic illness or other conditions resulting from the process of human aging, but that they are now adding this to their list and are showing up every day very heroically to provide that care, and we want to respect that. So we shouldn't be treating this list like a scorecard or a tally sheet, and we should not be stigmatizing these long-term care facilities because they have cases. In fact, it is inevitable that we knew we would see cases. So every entry on the list and every number is a human being, is a face, a family member, maybe your family member. Could be a friend or a neighbor. So please keep this in mind as the information is released and you see it on the websites. And be respectful of the residents and the families and the healthcare workers that support and the support staff and the business owners as this information is shared. These and other institutions and their staff have been working hard to address these challenges that they've been facing in these group settings. So we appreciate the intent of the governor's order and his desire to keep people informed. And going forward, we will ask people to be vigilant, to understand in the coming weeks as guidance emerges about how we begin to return to some sense of normalcy in some ways, that we're doing it safely and that we're following these tried and true public health guidelines, because that will be critical. We expect to continue to have cases into the coming months. We anticipate potential clusters of illness in the coming months. It is public health's job, working with partners, to stamp out those clusters and to control spread. And we're committed to do that here. And as local health departments in Ohio and around the country, we're committed to do that in our response. That's why we're all here. And so at this point, I'd like to turn things over to Dr. Gullett, who will provide us information on our usual data update. Thank you.
So good morning. Thank you again to our media partners and the Cuyahoga County Communications team who works really hard along with all of our other media partners to make sure that you can see this in real time and also have a recording to refer back to. I'd also like to thank Heather and Paul who are interpreting again for us an American Sign Language interpretation, which is very important to us. We have continued to provide more data each week, and with that, these press briefings get longer and longer on Fridays, and so we appreciate both of you working hard with us to make sure that information is communicated to every member of our community. I'd like to also thank this morning our public health teams at the local health department level and state health departments. I have thanked those individuals before, those teams before, but I wanted to circle back again. Last week was National Public Health Week, and in this pandemic, it seems like every week should be National Public Health Week because our teams at the local and state levels are working double and triple time to really be consistent with our public health approach. You have heard me talk over and over again about case identification, isolation, contact tracing, and quarantine, as well as cluster investigations, which are the cornerstones of the public health work we do. But our teams are also still maintaining, in many cases, those essential public health functions that they do every day, which are often invisible to the general public. And those are the things like keeping your food and water and air clean and safe. And so we just really want to honor those people who are our public health workforce, our sanitarians, our epidemiologists, our social workers, our dietitians. All of them are pivoting into this response while also still trying to carry forward the important day-to-day public health work they do. And that's happening across thousands of health departments and at the local and state level. I'd also like to take a moment to also thank all of the community partners in organizations that we have contacted where there are cases. That includes our long-term care facility partners, as well as employers and other areas where we have identified multiple cases. You have represented what is the very best of our community during this incredibly difficult time. You have led with a lot of poise, composure, and perseverance to fight for the people you serve on a daily basis. And we are incredibly grateful for that partnership and that leadership. And we here at the Board of Health continue to be determined to work alongside you and ensure you have the resources you need to make sure that your communities are well served during this difficult time. We also recognize that you're grieving the impact of this COVID-19 epidemic on your own community. That may include the way that you are impacted, the residents and clients you serve, the employees you have, the families you touch. And we want to honor that you are also dealing with that while you're really working triple time to make sure that everyone has what they need within your walls. So we thank you for that, and I want to publicly say that we are committed to continuing to partner with you. I'm also going to move into our data discussion, but before I do, I want to say that every week we are able to do a little bit more data analysis based on the information that we are obtaining. We're working very hard to obtain more and more information from everyone we talk to, and our epidemiology team is working very hard to continue to do new analyses that will help tell the story of how this COVID-19 pandemic is impacting our local community, nested within our state and our nation and the world. So we will continue to provide you as much information as we can, balancing transparency, which we fully believe in, with privacy, which we also fully believe in. And that's a difficult space to be in, but we're committed to both, and we'll continue to provide you the story as we understand it from the data and the stories we have from members of our community who are affected by coronavirus or COVID-19. So you're going to hear what we have today, and then we will continue to build on this story in the weeks ahead. I'm going to pause for a moment to allow Paul to reposition and our cameras to position to the slides. Cases are 224, which is a number to celebrate, and we will continue to mark as we make increased recovered cases as a movement toward progress here in our community. Our contacts and our contact tracing to date has been 2,244 contacts. I will say that some of those contacts have been removed from this number and actually put into probable cases or lab confirmed cases if they become symptomatic and also if they become tested and are positive. So it's important to know that actually we've had more contacts than that, but when they become cases, they move from the contact number up into the case numbers. The date of illness onset here represents that there is still ongoing transmission in our community. That means ongoing spread of this virus in the community. It is not stopped. So I want people to understand we need to stay the course with the measures we have in place right now. This is very, very important. Additionally, probable cases are, in this particular number I'm presenting today, are people who have had contacts with lab-confirmed cases and who then develop symptoms themselves. So those are the cases that you're seeing here, and I'll provide a little more breakdown of the ages for those cases and the race and ethnicity for those cases in a moment. Deaths in our jurisdiction, you heard our county executive talk about 42. When I pulled these numbers for analyses, we were at 41, but he is indeed correct. We have had an additional death overnight since I pulled these. I want to acknowledge that these deaths are in lab-confirmed cases. We are not reporting out numbers of people who have died with symptoms suspicious for COVID-19 that we're concerned about, but for whom testing was not available. These are simply lab-confirmed deaths, with the exception of one. And that person had a confirmed exposure to a COVID-19 positive individual and subsequently died within the time frame of illness exposure. So 40 of these deaths are lab confirmed cases, and one is a probable case who had what we call epidemiologic or a clear link to a lab confirmed case. The age range for these cases is 46 to 93 years of age. And the dates of the deaths are March 20th to April 15th. 54% of these individuals identified as female and 46 as male. Additionally, we had in our particular pool of cases, and these are lab confirmed cases, not probable cases. We had 24% of the individuals were hospitalized, 9% hospitalized in the ICU at some point during the course of their illness. This does not represent current hospitalization. This is simply at the time of, at some point in the time of their illness. We have released 1,263 isolation orders and 2,244 quarantine orders. These data are probably a little hard to see if you're watching online, but these will be posted on our website after the press conference. But I wanted to try and present as much as I could around the demographics we have for these cases. These are a total combined lab confirmed and probable cases on the top, broken out by lab confirmed in the middle and probable at the bottom. The circles represent sex, and the race and ethnicity data are in the middle, and age distributions on the far right. You will see we have a pretty similar breakdown of sex around male, female, race and ethnicity. On the total cases, 29% of the total cases, this is self-identified race and ethnicity, identify as Black, 54% identify as white, and other, it was combined. You'll see later when I present the county, there's another group that is broken out, and 14% were unknown. We've worked very hard to get as complete data as we can around race and ethnicity, but we still have some unknown data around both, and ethnicity is unknown in about 28% of our cases. 69% identify as non-Hispanic, and a smaller percent as Hispanic as well. The age distribution you'll see on the far right for total cases is very small for 1 to 19 years of age. And you'll see as it goes up, the increasing numbers of cases in the age groups of 50 to 59 and 60 to 69. I will not go through the different breakdowns of lab confirmed and probable, but I wanted you to have them. Our epidemiology team worked very hard to break things down and give you as much information as possible. The one thing I will say is around the probable cases, you see a very high percent as compared to total cases for those under one year of age to 19. And what you see there is household contacts of lab confirmed cases. So oftentimes, and you've heard me talk about this before, the biggest risk for transmission for most people is living with someone who is positive, and that's why we take isolation within a home so seriously. But we do have a lot of household contacts who have developed symptoms, but they haven't required hospital care and therefore remain in the probable case pool because they have not been tested. So those are a lot of children and young people who live in those homes. Kevin? This is simply the Flatten the Curve reminder of what we're trying to do here. Again, what we're trying to do is flatten a curve of how this COVID-19 or coronavirus infection has impacted our community in a way that we never reach the full capacity of our health system to care for those who are the sickest, who may need hospital care, intensive care, or ventilators. So our goal is to reduce the peak of that curve, and so we never surge above what we can provide in our community. This is the epidemiology curve, or the epi curve as we affectionately call it, for our community for this week since we started cases. We want to really emphasize, when you interpret this, please do not interpret the most recent week as us being on the other side of the curve. We are simply still gathering information about people who've become sick in the last week. It sometimes is that people aren't reported to us right away. Sometimes it's that we have a hard time contacting people. Sometimes it's that those individuals are quite sick in the hospital and therefore we can't talk to them to get more information. So we have some information about lab reported cases, but the red also includes lab and probable cases. And so there is still much more information to be added for the area over the last week. We have included again this week the recovered cases. What that means is we discontinue isolation for those individuals, and those are seen in blue. So we want to continue to provide you with that. We're also very committed to telling the stories of those who have recovered. They're important stories, and some of those individuals have indicated they would like to share their stories in a way that still protects their privacy. And so we would love to continue to tell stories about our community as much as we feel strongly about data. Stories and data together richly tell what is very best about how our community has responded here. And we're committed at the Board of Health to continue to do that. This is the zip code frequency map, and that means that's the number of cases in each zip code. This is as the epi curve included both Cleveland and the rest of Cuyahoga County, so does this map. And as I have said in previous weeks, this will continue to darken as more cases are found in each area of our community. And again, this represents where people identify they live. So it's the address that people identify they live at and the zip code associated with that address. It is not the zip code necessarily where they became infected. This also does not include probable cases. So it's important to understand this includes lab confirmed cases and where they live. And it only represents those who've been able to access testing, which our state health department has still restricted because of the limited testing available to those in the hospital who are the sickest, to our first responders, and to our hospital and healthcare employees. So that's what you see represented here. I wanted to provide a little more race and ethnicity data for the whole county as well. The median age for deceased individuals in our county is 78. The breakdown by race includes 2% who identified as Asian, 20% who identified as Black, 63% who identified as white, 15% for whom race was unknown. And we're still trying to obtain that information because we're talking to families, but we're doing that as much as we can in the most respectful and empathetic way as they've lost a family member. We also still need to talk to them for contact tracing. So we're trying to do that by giving them some space after their loved ones have died, but also trying to still obtain information so we understand how this is affecting those who've lost their lives in our community. We know that 71% have identified as non-Hispanic, a very small percent have identified as Hispanic, and then there's a 29% unknown. So we will continue to commit to trying to flesh that understanding out a little bit more. You'll know I didn't present last week because the number of unknown was even higher. So it's very important that we try to get accurate information. I want to pause for a moment and recognize these individuals. We have lost 42 people in our community who can never be replaced. We've lost people whose families are grieving, their friends are grieving, and we as a community need to grieve with them. And I'm very grateful to our county executive for recognizing these individuals through flying our flags at half-staff. But I would just really ask that everyone in our community think about these families this week and continue to do that. We are not done in this epidemic, this pandemic, and we have to continue to rally around those who are most affected. I wanted to also present the healthcare worker percent for our community. You'll note it's been hovering around 30%. We've been up as high as 33%, but this week is 28 as more people are tested and more people are hospitalized. It's, you know, some of those healthcare workers are hospitalized too, so, you know, it's hovering in that 28% range or 30% range. And those this week, I present another analysis that our team worked on, which was those who had pre-existing conditions. This is something we gather on our case interviews, and this is really important to think about who is most affected by this. And again, this is skewed a little bit because the people who have been tested, this is test data, those people have been in the hospital, so we have more complete data about their health conditions, but also those are the people who've been tested or the people who are sickest, who often have pre-existing conditions. So this is likely to be lower if we were testing the general public, because we know that this virus also affects lots of people who have no pre-existing conditions. So I want to just help people interpret these data. We want to share them with you, but recognize these data are limited given the limited testing that we have. We have to interpret it in the context of limited testing. I've been giving you hospital, what we call utilization, or how much of the hospital resources are being utilized at the county level. And recognize that this is also individuals who may live in other counties, so whose number of positive case is being counted in another health department's reports. And they're hospitalized here in Cuyahoga County. So at this point, our medical and surgical adult beds, so those are people sick enough to be in the hospital, but not need an intensive care unit, is at 62%, very similar to last week. For pediatrics, it's also very similar to last week at 35%, slight decrease. Our adult critical care beds are at 63% of the capacity, and that's a decrease of 5% from last week. And our ventilators are at 29%, which is a decrease of 6%, although the actual number of ventilators reported is slightly higher than it was last week. So we do have a slight bit more of ventilator availability, so it doesn't necessarily mean fewer people are on ventilators. You know, it's the exact numbers. The percent is how many ventilators are available. And then the last item here is all of the people who've been tested and the percent that are positive with the total number taken into account. And we do not have full data on this part. I continue to present it to help you see that between the different labs who are testing and the information we have received, the percent positive, meaning the number of positive cases compared with the total number of COVID tests run, is anywhere from 9 to 17%. And it's high in some labs because those are hospital labs, and they're testing the sickest people. So you have a population that we suspect is suffering from the infection, and we would expect that to be much higher than if we took a sample of the general population. There have been many questions about presenting race and ethnicity, as well as age and zip code data for all of those who've been tested. We do not have those data available to us. We will continue to present what we have available to us. It would be very helpful for us to understand where people live and what the age and demographics around lots of different things, including race and ethnicity of those who've been tested. But those information, that information is not at this time available to us. We are working with our partners who are running labs to obtain as much of that as we can. And if that becomes available, we will present it to you after analysis, and it would be an aggregate, meaning a complete analysis, not individual labs. So I would like to thank you all for walking through some of our data analysis this week, and for Paul for bravely interpreting my attempt to explain lots of data in a short period of time. We want to continue, as I mentioned earlier, to help the community understand what this all means. To allow the cameras to come back.
Are we in Q&A time?
Of course.
This is either for the director or for Dr. Gullett. I know the Ohio Department of Health is now posting the numbers for the long-term care facilities, and you guys have done a great job over the last two sessions kind of talking about that. But specifically, and it probably is applicable to many, but in the manor care situation, I know many people have been, families say they've been cut out of the loop. I guess, what do you tell those families that they say they've not been communicated with in a way that's appropriate given the number of coronavirus and COVID-19 cases?
So the question is in terms of the long-term care facilities out there, family members that are concerned about communication from long-term care facilities, and how that communication happens between that facility and families that may have family members that are residing at those facilities. So we know that several things have been happening. I have been on, and Dr. Gullett even, many more, countless calls along with the whole range of public health physicians that have been responding for over a month on countless calls every week with the leadership of facilities. And I want to first assure everyone that this leadership is committed to address concerns in their facilities, given that they're working with a whole range of very, very at-risk people. So we talk with the facilities about the need for communication. Certainly the governor's order, which has been released, talks about the need within 24 hours to communicate to families and staff where there have been cases in facilities. And it is my sense and my belief that these facilities are doing everything they can to try to communicate in a situation where there's a lot of anxiety. And I also would like to point out too, in these facilities and in other places that are frontline workers, that often, in keeping with the data that Dr. Gullett is presented, that they are often folks who aren't making much. And these are folks who are often people of color and are on the front lines, and they're scared. But they come back every day back to work to try to serve those residents because they know that they need their help. And that's heroic. That's truly heroic. So it is my belief that facilities are doing everything they can to communicate to families. There will be frustrations. There have been frustrations. I think across the board, we've heard some of them on phone calls about essential services, on concerns about not having enough personal protective equipment in certain circumstances. We hear those and we understand them. And so I think we all take a collective deep breath as we go forward, because this is really the end of we are ending sort of the initial stage of this. It's just the beginning of the new normal. And so as long-term care facility families that have grandparents and friends and family and neighbors in these facilities have concerns, we recognize that. We would just ask that you give these long-term care, the leadership of these facilities, time to address this, even as they've been working around the clock to prevent cases and to be, I think, empathetic and also incredibly supportive of those residents that need their help.
I would just also like to take you for a moment inside what our communications look like with these facilities and all of our cluster investigation partners. We have very structured calls with them, but we're also in these facilities ourselves. We have physicians and sanitarians in many of these facilities, partnering with them to make sure that we're looking at every potential place where an infection could spread, and they have been nothing but receptive to every single one of those steps. One of our structured elements in our calls with every single entity that's been affected by COVID-19 with a cluster is that we talk about communications. And Kevin, our communications officer, is a part of every single one of those calls. And I can tell you that every facility we've been involved with, regardless of whether it's long-term care or a different type of organization, has provided us with detailed information about their communications with their own internal residents or clients, with their own employees, and also with the external, media. And part of that resident and client communication is also about families when those clients or residents are maybe not able to articulate as much as they could. So I want to assure you, without getting into very specific information that would identify a particular organization, that they have uniformly been supportive of that approach and have actually, in most cases, already done that before we've even talked to them. So that's a really important part of this. Communication is really hard for everyone because it changes constantly. And what we try to reassure people, especially during these press conferences, that the numbers I gave you have changed in the time I've been standing in front of you. And that happens for our facilities too. And so sometimes I think that it's hard to message when it's constantly changing. So we're trying to help people understand that piece of this too, that it's not about hiding numbers, but it's about making sure we give you the most updated information as quickly as we have it. And I know they're trying to do the same. I would also encourage you to check the Ohio Department of Health website, again, given some changes in numbers. That's important as well. We want to accurately represent what we see.
You guys believe that Cuyahoga County is going to be ready to at least phase 1 of reopen on May 1st?
I'll start, and then I'll pass it over to the health commissioner. So I would like to remind everyone that our models are dependent on strict social distancing. And what we are seeing is still new transmission happening in our community. So we are committed to ensuring that we are in lockstep with our state leaders at the government level and in our state health department. And we continue to communicate regularly with them about what we're seeing here in Cuyahoga County on the front lines. But we cannot let off. What we're seeing now is often what happened 2 to 14 days ago. And so we have to recognize that unless we stop transmission that's still happening, we're going to continue to need to address this in a very robust way. This is a long-term proposition for all of us. This is a marathon, not a sprint. And given the continued transmission, we need people to wear masks. We need people to socially distance. We need people to not have parties. We need people to not have gatherings. We need people to work remotely whenever possible. And so we will continue to work with our state leaders around what we're seeing on the ground. But the message for our community today is that we can't let up, and we'll continue to see what happens over the next few weeks. But I'm articulating to you today that I'm still seeing transmission, our team still sees transmission, and our team still sees people who are ill.
Are you concerned that May 1st is too early?
I'm gonna let Terry finish, and maybe that'll answer your question.
So the question is are we concerned that May 1st is about the date in terms of the opening up time? I think that it's hard to set a date on these things. For me, what's particularly important is that we understand that we have to continue to, we're going to need to develop a lot of guidance that is around a range of ways that we interact. And CDC and the State Health Department and the Cuyahoga County Health Department working very closely with the Emergency Operations Center that Executive Budish has stood up for the community, working very closely with them. We have been developing guidance and will continue to do that. We need to be creative about how we understand the safest way to conduct business. And so we will follow the governor's playbook and Dr. Acton's playbook. It has served us well. But going forward, there's several things I think people need to consider. One is that we expect more testing to become available here in the coming weeks and months. And as we seek, we will find there will be more cases. More testing means more cases, and we need to understand that. So a lot of our numbers, all the numbers are tied to testing. We can only know where we test. And so We also have heard Dr. Fauci say that up to 50% of people may not have symptoms and can transmit, being asymptomatic. So we need to understand that. The testing is critical for us to identify and reduce risk and the potential for more cases. The testing is critical to identify potential risk and to prevent future cases. And we all have to lead by example. It was great to see members of the media wearing masks because people will be watching you on TV and in your communities, as leaders in your families and in your places of work. And for me, that's leadership. And so we all have that responsibility to lead by example, to follow the guidance that will emerge as we're creative in assuring that we reduce the risk going forward in the community, even as we begin to address the disruptions and start to address bringing society back to some sense of normalcy. But it's about protecting the public's health, our collective health. And in that regard, all of us are public health workers, in our families, in our neighborhoods, and in our businesses. And that's a good thing, that we recognize how critical it is to the health of all of our friends and family. And at the end of the day, good health is tied to the opportunity to work, to be productive, to give back to society, those that volunteer. And that's the heartblood of Greater Cleveland and what we do here. And so follow the guidance and lead in your communities as the guidance emerges to try and reduce risk, because reducing risk reduces fatalities in the future, and all of us have an interest in doing everything we can to protect the Greater Clevelanders.
Is May 1st in the best interest of the health of Cuyahoga County?
I don't know what the best date is, Scott. The question was, is May 1st in the best interest of Cuyahoga County? I don't know what the best answer is on a date. What I do know is that May 1st, there is not going to be, as has been said, there is a detailed plan based on the data and the science on how to roll back incrementally and with protections to try and reduce risk. I don't know what the exact date is, but I will tell you that we have continued to have great faith in the governor, Dr. Acton, and their leadership, and we're going to do the best we can to assure that we continue to work here to reduce cases and the potential risk in the community. That's how we stood together, and we'll continue to do that through this response.
I'll also try to answer the question, but let me first, I did not mention the President's Council when I was listing our partners, and I want to make sure that I include them. I also did not mention our Economic Development Director, Ted Carter, and Paul Hertig, who both worked very, very hard to put this small business program together. In terms of being ready, we've had an internal group working to make sure that the county itself, as a government, will be ready when we are advised to reopen. We have seen changes in the county government operations and throughout the business community and the general community, which I think those changes will continue. It will be a different world going forward. We have learned that a lot of work can be done remotely and can be done efficiently and effectively, and we will continue those efforts in the new era of post-coronavirus. We have been out there aggressively pursuing protective equipment for people, including the people in the nursing homes that you mentioned, and we will continue to do that, because just because business and the community starts to reopen doesn't mean we're not going to still have to follow the advice that we've been preaching for weeks, and that is the hand washing, the social distancing, and making sure that you wear the masks and other protective equipment. We will be in a much better position going forward than we were at the beginning of this crisis, because nobody anticipated it, and unfortunately the strategic stockpile was not sufficient to provide the protective equipment people needed throughout the county. So we will be ready, both internally and for the community, when we are advised by the medical experts that it can be done safely.
We'll take one more question.
You know, now that, well, county executive, now that he's up at the stand, I was gonna ask him a question. I'm not sure if you're familiar with this, but, I know at one point when the, inmates were released, there was no violent offenders known. India Rogers, is a woman who's, up for murder. She was released, I think it was over the prosecutor's objection, the judge, went ahead and did that. I guess if you're familiar with that, what do you know about this case and what are the possible motivations?
I don't know anything about the specifics of the case,
Fair enough.
All right,
but I can say we're down under 900 inmates now in the jail, and that has made a huge difference. By reducing the population, the risk of infection spreading has been minimized, and I know that the prosecutor and the judges have done their very best to make sure that it's done in a safe way for the community.
Thank you very much.